Good morning, everyone. Thank you for joining this webinar, Likely Bedfellows, Partnerships for Healthy Corner Stores. This is Hannah Burton-Lorison, consultant with ChangeLab Solutions, and I'm joined by a great team of presenters, my colleague Malia Schultzman with ChangeLab Solutions and Vic Coleman from the Childhood Obesity Prevention Coalition. I will introduce the two of them in more detail when they speak, but wanted to welcome them and you to the call this morning. This webinar is the second in a series we're calling New Carrots on the Block, presented by ChangeLab Solutions in partnership with the Network for Healthy California. And for those of us who aren't familiar with ChangeLab Solutions, we're based in Oakland, California, and we use law and policy strategies to create healthy communities nationwide. We are one of the co-sponsors of the Healthy Corner Stores Network, which supports healthy corner store projects all across the country. And our team is available to work with you on a range of strategies to create healthy communities. So do please contact us at the end of the webinar to see how we can help with your corner store work. As I said, this is the second in a series. The first covered distribution challenges to healthy corner stores. You can listen to it archived on our website, changelabsolutions.org. And please do join us at the end of July for a webinar focusing on community-driven strategies for corner store conversions. I hope we'll actually begin to weave some of those threads into today's presentation, because one of the reasons why partnerships matter is that it brings an ever-broadening array of collaborators to the healthy corner store work that we all care so much about. Our webinar today is made possible by support from the Network for a Healthy California, and I wanted to thank them and make sure that all of you on the call who are not familiar with them know that they are also a fantastic support for neighborhood stores with many, many resources, and we're very happy for their support for this webinar. So this is me, Hannah Burton-Lorison. I am a consultant with ChangeLab Solutions, and I first began working with Healthy Corner Stores in Philadelphia, Pennsylvania when I was working with the Food Trust. And at that time, my goals were really quite modest. I wanted to see if it was possible for small stores to stock a selection of healthy snacks for children on the way to and from schools. And I first started wondering about partnerships with tobacco control advocates specifically one day in 2003, when I walked into a store. I was there to survey the nutrition content of the snacks with my clipboard in hand. I imagine many of you on the call have done something like that. And on the way into the store, I was stopped by a man in a wheelchair who asked me to buy a Lucy for him. He couldn't get up the steps into the store. And I agreed to the favor and went into the store. And behind the counter was a young boy, couldn't have been more than 10 years old, who was minding the store at that moment in time. And he had to climb up on a stool to get the single cigarette down. That experience really set the wheels turning for me. It really raised the question of, even if we as advocates of healthy eating succeeded beyond our wildest dreams and changed all stores to offer only the healthiest foods, would we be done if those stores still sold cigarettes and alcohol? And what could be done to strengthen the business model of small stores so they could be profitable without cigarettes and alcohol? That, of course, was a decade ago, and the field of healthy corner store work has evolved a great deal since that time. But from my perspective, nutrition advocates still work largely separately from tobacco and alcohol control advocates in the retail space. So this webinar will examine some of the reasons why that is and offer you, I hope, a lot of ideas for bridging the gap and creating partnerships to deepen our impact on stores. So for our agenda today, that's exactly what we're going to do. You're going to hear from three perspectives: healthy eating, tobacco control, and alcohol control, about the funding streams and about the regulatory framework that really guides work in the small store environment and dictates the strategies that each of these advocacy communities pursue. Each presenter will outline a series of promising opportunities for partnerships in the field, and then I'll try to bring it all together with some recommendations for next steps. And you're going to have plenty of time for questions during our virtual office hours. We'll have an extended Q&A period at the end of the presentations. But you're always welcome to enter questions into the chat box as the presenters speak. So for those of you who are on the call today, you're no stranger to what the typical corner store business model is. It's this trinity of alcohol, tobacco, and unhealthy foods that are the base for most small food retailers. Now, I recognize that we have a few folks on the call joining us from other states that may regulate alcohol differently, and it may not be available in corner stores. I will be speaking from a California perspective, so those of you who are on the call from other states, please do contact us for a bit more information about your state's particular regulatory framework. Now, we know that distributors and manufacturers of alcohol, tobacco, and even some of the unhealthy foods offer incentives to store owners for pricing, placing, and promoting their products. And we know that these products are tremendously profitable to the store owners. And so that really stacks the deck against those of us who want to see a change in the store environment. What do you see when you look at this picture? And I'm imagining you can quickly make a long list of things you might wish you could change about what this store owner is selling. Most of us can probably quickly identify the cigarettes at a very affordable price, the ice cream and candy on display, and the alcohol, regardless of your particular professional background. And what do you think when you look at this picture of the store owner? I think one of the interesting frames that I want to offer at the start of this webinar, that speaking in very broad generalizations, nutrition advocates, I would say, tend to view these store owners as partners, a friendly, important part of a healthy community, and as such offer incentives and technical assistance in order to support healthy changes in the stores. By contrast, and again speaking very broadly, I would say that alcohol and tobacco control advocates tend to take a more skeptical look at store owners. And because there's so many alcohol and tobacco regulations at the store level, alcohol and tobacco advocates tend to worry about store owner compliance with existing regulations and therefore have a focus on enforcement. So we'll talk more about how a regulatory versus partnership orientation to stores and their owners affects which strategies each field chooses later in the webinar. So despite our differences, I would definitely posit that tobacco and alcohol control and nutrition advocates are all really asking the same basic question: how can stores shift to a healthy food retail business model? And I would posit that each field does see three basic components to this equation. First of all, we all identify standards we want the stores to adopt, either voluntarily or through policy. We might consider incentives or support to encourage the stores to adopt those standards, and we might adopt enforcement schemes to make certain that the stores follow the standards. And if these components are in place, we hope to shift to a business model that relies less, or perhaps not at all, on unhealthy products and shifts to an economically sustainable good neighbor model. But what are the standards, incentives, and enforcement strategies that work across each of our advocacy communities? Unfortunately, I think too often each field develops policies narrowly focused on its particular target. And sometimes, of course, that's driven by the policy framework in which it functions. That dictates a particular approach. But I think there are a lot of advantages for collaborations, from partnerships to policy. So I'd like to start things off by hearing from you. Do you currently partner with healthy food retailers? In your healthy food retail work, do you currently work with alcohol and tobacco control or healthy eating advocates? Please enter your answer into the poll, choosing the one that's most true for you. So we're seeing that there is a lot of partnership going on, and many of you are in the contemplating stage. As you enter your choices, please also use the chat box to tell us if you have partnered or have thought about it, what you see as the greatest barriers to collaboration. So here we see some partnership with tobacco control, less with alcohol control, and a great deal of partnering with healthy eating advocates in your community, and many of you in the talking and thinking about stage. Very curious to hear from you what you see as the challenges to partnerships for healthy corner stores. As you enter your responses into the chat box, I'd like to list the big three from my perspective. So the first is that each of these consumer products, tobacco, alcohol, and unhealthy foods, have really different regulatory frameworks, and that influences the options for action. So we're going to hear from Vic Coleman how alcohol is primarily regulated at the state level in California compared to tobacco, where local governments have more options. But there are some common frameworks. I think probably the most important to this work, all of us are governed by the First Amendment, and that places important limitations on regulating commercial speech. But it also does present some opportunities for common goals in the ways that we are allowed to move forward under the First Amendment, which we'll discuss later in the webinar. And I wanted to say that before we hear about the regulatory framework for tobacco and alcohol control, I will also give a brief overview of the regulatory framework that governs small food retailers, and you may be surprised at how very complicated it is. The second major barrier that I see is really such an obvious one that it almost doesn't bear mentioning, but it is really the elephant in the room. The separate funding streams really put us in professional silos and I think discourage innovation in many instances. But I think here in California in particular, we're seeing quite a lot of leadership in local communities as well as from the State Department of Public Health to really look for opportunities for collaboration. So we hope that by the end of this webinar, you'll be equipped with some ideas about how to reach out to your colleagues in alcohol and tobacco control and nutrition, if you're coming from alcohol and tobacco control perspective, to come up with long-range strategies for collaboration as well as some near-term steps, even if that's not dictated for your funding streams, dictated by your current funding streams. And then finally, as I've already touched on, each of these professional fields uses different strategies for change. And because alcohol and tobacco control are highly regulated substances, advocates have over time been able to build political will to pursue a broader range of regulatory strategies. And I wanted to flag the issue of time in particular. I think the focus of healthy eating advocates on the corner store field is still relatively new. This is a strategy which I would say really began to build some steam maybe just 5 to 7 years ago as a strategy that's being pursued more broadly, where tobacco and alcohol have a history that goes back much further, which is quite rich and where there's a lot of learning to be captured. I think we're all following the public debate around regulating access to specific foods like sugary drinks, and that is so politically controversial. So it really may be time before that is a viable strategy for nutrition advocates. But we will hear from Malia Schultzman about one promising strategy for promoting healthy food availability while requiring compliance with alcohol and tobacco control regulations shortly. So now let's take a look at what you all listed as the barriers that you're seeing. I'm hearing about some nodding of the heads on grant guidelines being a barrier. I'm hearing that the partnerships, quote unquote, I'll put that in sanitary blips, with companies producing unhealthy products, providing financial incentives to retailers to promote their products, to place them, that stacks the deck against your work. That's less true in healthy food retail, but a big issue for tobacco and alcohol control advocates. Then I'm also hearing that retail tobacco and alcohol is touchy because it's seen as we're trying to take something away from them, but food is a more positive spin. And that really resonates with my experience as well, that food can be a point of entry that is seen as more in the spirit of collaboration and can be a great point of entry for building a more positive relationship with retailers. So we'll talk more throughout the presentation about this idea of building political will for these cross-sectoral policy approaches, and I think that point is really important. That food can be a more positive point of entry than the regulatory approach of tobacco and alcohol control. So, since most of you on the call today are coming from the healthy eating perspective, I did want to provide a brief overview of the laws regulating the sale of food in the small store environment. And I think that many of you will be familiar with some aspects of this framework, but I did think it was a useful context for a discussion around collaboration, since we're going to hear about the framework for alcohol and tobacco sales as well. And I think it's also a helpful reminder that store owners are complying with quite a few requirements, which is useful, I think, for explaining some of their skepticism about partnering with local government. And I've heard so many stories from local health department staff about coming into a small store environment with their clipboard or whatever whatever the kids are doing these days with iPads and iPhones, and being really met with skepticism and that fear of enforcement getting in the way of partnerships. So I think this will provide a little bit of a retailer eye perspective on the regulatory framework that governs our work. So from a nutrition perspective, retailers are governed by every level of government, from federal right down to local. Starting at the local level, they're probably the biggest piece of regulation that they encounter is the Retail Food Code. That's set by the state. Most states follow a uniform Retail Food Code. California deviates from it very slightly. This is enforced by the counties and means that they're inspected annually by the health department. And the Retail Food Code is, I think, something really important, a piece of regulation for you to keep in mind if part of your corner store change strategy includes a shift to more prepared foods, since generally speaking, the more the foods are processed or handled in the store, the higher the scrutiny the store owners will be subjected to. But that's not the end of the local regulations that store owners are subjected to. There are a wide array of other laws that may be acting in your community, governing operating hours, what the facade may or may not look like, parking near the store, lighting, loitering, littering, and so on. So there's quite a lot of complexity there, and that's something that you need to dig into at the local level to understand further. I already mentioned the First Amendment as being a very important frame for this work, and that one of the ways that limits the kind of work that we can do in nutrition, healthy eating advocacy, as well as in tobacco and alcohol control is in content-specific restrictions. And so there are very important limitations there. However, voluntary initiatives to promote healthy options are permissible, and that's obviously a strategy that many healthy eating advocates do pursue. I would be remiss not to include a brief mention of the federal nutrition programs, SNAP and WIC. They are also filled with rules pertaining to the retailers who participate in the programs, specifically covering stocking standards and strict regulations governing fraud. And I strongly encourage you to make sure that any retailer who's offered incentives through your Healthy Corner Store work has a clean record with the relevant SNAP or WIC agency. And I would also, and the inverse of that is also true, I'd also strongly encourage you to make sure that stores receiving those incentives or support are enrolled in those programs wherever possible to offer the greatest access to SNAP and WIC participants. And ChangeLab Solutions has a number of resources assisting retailers to participate in those nutrition programs where appropriate. So that's the very quick overview. It's not all. As I mentioned, your community may have adopted some or even more of the regulations at the local level. So do speak to your local planning departments and county council to understand that more fully, and make sure that the certified stores comply with established laws. There are unfortunately too many stories from around the country where healthy eating advocates have established partnerships with a seemingly friendly store owner to later be embarrassed to find out that there was some non-compliance with a local law hidden in the store owner's past. So that's certainly something to have in your mind, to make sure that the store owner is a good citizen and in compliance with the food regulations governing their small business. So that's a quick overview. Again, please do enter questions about any of the content that I've just given, or Malia's content coming up into the chat box on the lower left-hand side of your screen. We're going to shift now to hear more about the tobacco control regulatory framework and opportunities for collaboration from my colleague Malia Schultzman. She is a staff attorney at ChangeLab Solutions, where she works on legal and policy issues related to tobacco retailer licensing. She's going to explain what that is in just a moment. And I think that's a very interesting node of potential collaboration from a healthy eating perspective. She also works on secondhand smoke exposure. And prior to joining ChangeLab Solutions, she worked with the National Housing Law Project on a variety of issues affecting low-income families, including fair housing protections and preservation of affordable housing and access to communities of opportunity. So she really has a holistic perspective on what a healthy community means. She's a graduate of Gonzaga University in Spokane, Washington, and attended UC Berkeley School of Law. Malia, thanks so much for joining us.
Thanks, Hannah, for that great introduction. As Hannah mentioned, I focus on sales and marketing of tobacco products, and specifically on how we can restrict products that may be particularly harmful to youth. I'm happy to answer any questions you may have regarding laws affecting tobacco sales. I love providing technical assistance. It's one of the favorite parts of my job. In terms of what I'm covering today, I'm going to discuss how some of the tools used by tobacco control advocates could be adapted to help support healthier corner stores. I'll begin by discussing the regulatory framework that has shaped tobacco control advocates' approach toward corner stores. And I'll then discuss some areas where there are opportunities for collaboration among tobacco control, alcohol, and nutrition advocates. I just want to start by acknowledging that tobacco control might have a different perspective on corner stores, as Hannah mentioned. And the reason is that some of us come from the perspective that corner stores sell harmful products, and those products need to be regulated. And the focus for some tobacco control advocates has been how we can reduce the number of tobacco retailers in the community and end the sales of those harmful products. So in looking at this store in the photo, the first reaction that some tobacco control advocates might have is that the store has a lot of ads for harmful products, and it's selling cheap flavored tobacco products that are dangerous to kids. And I'll admit, when I saw this store, which is down the street from us, I thought to myself, my community really needs to do something about those cheap cigars and flavored tobacco products. And I wonder whether that sign on the sidewalk is illegal under local law. And so a tobacco control advocate like me might immediately focus on strategies to stop the store from selling the harmful products or to limit its advertising, rather than thinking about incentives that might help this business transition to healthier foods and reduce its advertising for these products. And that's where I can learn a lot from you in the nutrition advocacy world. The first thing that a nutrition advocate might notice about this store is that it's selling some staples such as milk, eggs, and bread. And a nutrition advocate might look at this storefront and consider whether there are ways to get this retailer to carry some additional healthy foods instead of some of the harmful products that the retailer is selling. And I don't mean to say that these perspectives aren't at odds with each other. By the contrary, I think this illustrates that we have a lot to learn from each other. So now I'm going to broadly discuss how tobacco is regulated in California. My segment will have mostly a California focus. And I'll explain how that regulatory framework has shaped local tobacco control advocates' approaches to corner stores. Under state law, retailers have to get a one-time license to sell tobacco. And the primary purpose of that state license is basically to help the state collect tobacco taxes and to prevent smuggling of tobacco products. The state licensing law, it's not really intended and it's not really designed to address the public health effects of tobacco use. The penalties really aren't strong enough to deter retailers from violating tobacco control laws. Now, there are some additional federal and state tobacco control laws that are really intended to get at some of the public health issues associated with tobacco use. So of course we have laws that prohibit sales to minors. There are other federal and state laws that use other techniques for trying to reduce minors' access to tobacco, such as putting limits on vending machines, self-service displays, and the loose cigarettes that Hannah talked about earlier. But a law is only as good as its enforcement. And to make those laws work, retailers have to be inspected regularly to make sure that they're in compliance. We have over 36,000 tobacco retailers statewide in California, and it's difficult to monitor all of them on a regular basis. And as a result of that, many cities and counties want local options for making sure that tobacco retailers are following the law. Fortunately, state law makes clear that cities and counties in California can adopt their own local tobacco retailer licensing laws, and over 100 jurisdictions have done so. These local laws give cities and counties flexibility to adopt their own licensing program to ensure that businesses are complying with tobacco control laws. So under a local tobacco retailer licensing law, any business that wants to sell tobacco has to apply for and obtain a license from the local government. And I'll discuss that more in a minute. So now that we've covered how tobacco is broadly regulated in California, I'll discuss 3 potential areas in which nutrition and tobacco advocates can collaborate. And those are licensing, certification programs, and signage restrictions. I'll begin with licensing and how cities and counties have used it to promote responsible retailing practices. Licensing, it's a very common policy tool that state and local governments use to regulate individuals and businesses like pharmacies, restaurants, and alcohol retailers. The idea is that if you're going to engage in an activity that could affect public health or safety, you need to meet certain minimum requirements as part of operating your business. Most cities have a local business license requirement. It controls who can do business, where they can be located, what conditions they have to meet, and how the city will enforce those conditions. But usually these business licenses have very limited requirements. Basically, the business owner pays a fee and files some information with the local government, such as their legal business name and location, as well as their tax ID number. But in many communities, there are certain types of businesses that have to obtain a special license that goes beyond the basic business license. And those special licenses serve more of a regulatory purpose. The concern is that there are certain businesses that have a greater impact or greater potential to impact public health than others. So Hannah mentioned the example of food facility permits. Businesses like restaurants have to comply with specific food safety handling practices in order to get a license to serve food and prepare food. They need to meet certain standards regarding equipment and heating and cooling. And only those restaurants that have been inspected and follow those approved practices can get a food facility permit. So as another example of licensing for public health purposes, I'll talk about local tobacco retailer licensing programs. As I mentioned, several cities and counties in California have taken this approach. And the idea is that businesses that want to sell tobacco have to get a license from the local government in exchange for the privilege of selling those products. As a condition of getting a local tobacco retailer license, a business has to comply with all local, state, and federal tobacco laws. And local governments can require retailers to pay an annual fee to cover the costs of administration and enforcement, such as store inspections. In addition to the very basic local tobacco retailer licensing requirements that you comply with state and federal tobacco laws, a growing number of communities in California are taking an additional approach where they're advancing some really innovative public health initiatives through their licenses. So as an example, Some communities are, and I'll also note that several of those policies are relevant to nutrition advocacy and represent some areas where we could be collaborating. So as an example, some cities are prohibiting delis and other businesses that sell food for on-site consumption from selling tobacco. Some communities are limiting the amount of signage that tobacco retailers can display, which I'll discuss more about later. Some communities require that tobacco retailers be at least 1,000 feet away from schools. And others have taken the approach of just limiting the total number of businesses in a community that can sell tobacco. Basically, for example, some communities base that limit on population. Finally, another emerging trend is that some communities are prohibiting stores that contain pharmacies from selling tobacco. Because these local licensing programs affect who can sell tobacco and where, nutrition advocates might be really interested in collaborating with tobacco control around licensing. For example, when communities are thinking about prohibiting businesses near schools from selling tobacco, a complaint that's sometimes heard from retailers is that this is really going to hurt their businesses and that they're going to lose money if they can no longer sell tobacco products. As tobacco control advocates, we could really benefit from nutrition advocates' knowledge and experience to help us figure out whether there are some alternative business models for those retailers. And is there something that we can suggest instead to replace that shelf space that will no longer be hopefully filled with tobacco products? I'll note that we've developed a model tobacco retailer licensing ordinance which has some really great customizable options for controlling who can sell tobacco and where. So licensing of tobacco retailers isn't the only place where licensing can be used to improve public health. Communities can use a healthy food retailer licensing program to ensure that food retailers are benefiting the communities that they serve. This is a really new and emerging idea, and it's definitely a place where I think we all need to take our combined experience and figure out how to make this work. Under this type of licensing system, food retailers would be required to carry a minimum selection of healthy foods and meet other health-related standards in order to obtain an operating license. So for example, you could require a food retailer to comply with all alcohol and tobacco control laws in order to obtain that operating license. Incentives could be offered to retailers who go above and beyond the basic requirements, such as offering an incentive to a food retailer who agrees to reduce the amount of tobacco and alcohol products that the retailer carries. We've learned from the tobacco control perspective that licensing can be an effective tool to improve public health. It has reduced the sales of tobacco products to minors. And we've also learned that partnerships with local governments, public health professionals, and community-based organizations are essential to making a licensing program work. And similar partnerships could certainly be formed to explore licensing for healthy food retailers. And we've included on this slide our model licensing ordinance for healthy food retailers, which is available on the web. Now that I've discussed licensing, I'll move on to the next area where nutrition and tobacco could collaborate, and that's certification programs. These are voluntary programs where food retailers can apply if they want to participate. And they basically enter into agreements that they'll increase the variety of healthy foods that they'll sell. And in exchange, they receive benefits such as free publicity and help implementing those healthy changes. The ways in which we could collaborate on a certification program are somewhat similar to the ways that nutrition, alcohol, and tobacco would want to collaborate on a licensing program. As I mentioned, you could offer incentives to retailers who, as part of the certification program, agree to reduce the number of tobacco products that they carry, or who agree to reduce their advertising. we have a great product that explains certification programs in more detail. But the takeaway point is that if you're interested in certification programs, it's really worth exploring how we might all collaborate to help support this effort. The last piece I'll touch on are signage restrictions. And this is a place where alcohol, tobacco, and nutrition can all collaborate. As many of you know, California law prohibits businesses that sell alcohol from covering more than 33% of their windows with signs of any kind. And the idea of this law is to enhance public safety by making sure that law enforcement has a clear view into stores. In addition to that state law, many local governments have used their traditional zoning powers to restrict the size and location of signs. For example, to reduce clutter and to improve public safety, a city could prohibit retailers in a particular business district from covering more than 15% of their windows with signs. The traditional reason why cities and counties have enacted those signage restrictions have been for community aesthetics and public safety. But of course, an indirect effect of having these signage restrictions is that they reduce the amount of advertising that corner stores and other retailers display, regardless of whether that advertising is for soda, alcohol, or tobacco. And as a result of that, it's really beneficial for all of us to partner in efforts to enforce existing signage laws, including the state law I just mentioned, as well as any local signage laws that are in your community. We could also partner on efforts to encourage retailers to voluntarily reduce signage, perhaps as part of one of the incentive programs that I had mentioned earlier. I'll just briefly note about the First Amendment. As Hannah touched on, laws that prohibit ads based on their content could be problematic under the First Amendment. But changes to a city or a county's sign law that generally reduce the amount of signage are still permissible, as long as you're not singling out advertising for a particular type of product. As Hannah mentioned, voluntary programs are also permissible. For example, asking retailers to voluntarily remove ads for unhealthy products as part of participating in a healthy food retailer certification program. Regardless of the strategy that's used, though, efforts to reduce signage and make storefronts safer represent another opportunity for collaboration between tobacco, alcohol, and nutrition. With that, we'll actually get more into detail about alcohol with Dick Coleman.
Thanks so much, Malia, for all of that context. I know that I have so much to learn from tobacco control advocates who've been working in the retail environment for so long, and it's really interesting to hear your thoughts on collaboration. We've had a bunch of questions come in while you were talking on the idea of incentives as a part of tobacco retail licensing. Can you identify any examples of communities that have adopted a tobacco retailer licensing ordinance that incorporated incentives?
Actually, so this is a great point about why collaboration would be great, because I'm actually, mostly in tobacco retail licensing laws, folks have taken the stick approach, where it's really, in order to maintain your license, and your license is a privilege, you have to control with all the local and state, you have to comply with all the local, state, and federal laws. I'm not really aware of many examples, if any, where local tobacco retail licensing has included an incentive, but if others are aware of it, please let us know through the chat box. But again, this is a great example of why we do need to, I hate to use the phrase break down the silos, but discuss how we can more effectively use incentives to get retailers to reduce the amount of tobacco that they're carrying and replace it with healthier products.
Thanks. That's really interesting. I know that just not working in the field of tobacco control, but sitting in the same office with those who do, I sometimes hear stories about the kind of opposition that comes up in communities to tobacco control policies writ broadly, not just to licensing, and certainly the question about the economic viability of the corner store model without tobacco products is mentioned frequently. So it seems to me that being able to incentivize healthy eating as a transition to a different business model could be a really interesting rebuttal to those sorts of claims. We had another question come in, and I don't know if you have this information, but it's a great question. As the as the smoking rate has decreased in California, have there been any efforts to collect data about how tobacco retailers have had to shift their model since their customer base is decreasing?
I think that's a really interesting question, and again, another piece that we really need to look into. I don't have any information about that off the top of my head, but as the commenter points out, it would be really critical to gather that information, because as we're moving to a system where we want to think about what can we tell retailers to replace those unhealthy products with, or what can we explain to them has been a successful business model in other areas, that type of information would be really helpful.
Great. Well, it's fantastic to see how your presentation is sparking some questions. We're having several other questions come in, but I'm going to save those for the virtual office hours, which will kick off at noon Pacific, and we hope that those of you on the call will stick around and continue to ask more great questions as these comments stimulate your thinking. So I'd like to shift now and introduce even another regulatory framework into the conversation. We're honored to be joined by Vic Coleman with the Childhood Obesity Prevention Coalition, and he has a lot of expertise in a wide range of public health strategies. So I think it's just so great to have him on the call, since he already in his professional life has worked across an array of strategies, and I'm thrilled to hear his thoughts on collaborations in the small store setting specifically. So a bit more about his background. He's worked in the public health field for over 29 years, initially here in California for nonprofits and at multiple levels of government, focusing on primary prevention and the related policy systems and regulatory solutions. And then in Washington State, he's been a legislative liaison and policy advisor at the State Department of Health for 8 years, and is currently co-principal of a public policy consultancy in Olympia called Uncommon Solutions. And he also serves as the director of the statewide Childhood Obesity Prevention Coalition. And Vic got his BA at Michigan State University and his JD from the University of San Francisco. And I'm just really thrilled to have someone on the call who speaks these multiple languages to unpack alcohol control for this audience. Vic, thanks so much for joining us.
Great. Thanks, Anna. Let's get started. I want to tell a quick story to begin. I was working in a Bay Area county in alcohol prevention. This is the late 1980s, and there was a neighborhood association that was upset with the typical sort of complaints you get about an overabundance of corner stores selling alcohol. So the loitering, the littering, and all that comes with that. And I was sort of playing an advisory role to that community association, and one of the strategies they undertook was to take that clipboard that health departments walk around with. Oh, I'm hearing that it's hard to hear. Let me take this off. I have a wired headset. Let me try something else. Okay, let's see if this is any better. If I get a couple messages to confirm this is better to hear, that'd be great. So the story I want to tell is in this Bay Area community in the late 80s. So this neighborhood association was concerned about an overabundance of liquor stores, corner stores that were relating having a number of difficulties related to primarily alcohol consumption and the littering and loitering, et cetera. So as an advisor to that community association, they started a dialogue with the corner store owners. And what was fascinating to me at that point was they had, the first time, real dialogue between community members who are walking into these stores with these clipboards, and of course at first the corner store people were like, "Are you from the health department?" They'd be like, "Actually, no, I'm your neighbor." And they asked why they were there, and they were actually trying to figure out how much shelf space was being devoted to alcohol from a sort of percentage standpoint. But the real important point of having community people walk into corner stores that they don't shop at was the dialogue that happened. And the dialogue was about, you know, I live around the corner and I never shop here. And the store owner would say, "Why is that?" "Well, I don't buy a lot of alcohol, but if you carried fresh produce, if you carried other products instead of either alcohol or dusty soup from the late 1970s, you might see my face in the store a little bit more." And in fact, what happened was a lot of voluntary changes happened across a number of different corner stores in that community because the store owners realized they were missing a market, the local consumer market, right in their own backyard. So that was a whole voluntary effort, and you know, some of those changes did stick around. But this was, you know, almost 25 years ago, and I had the light bulb go on then, like, maybe we should be thinking more about how we can develop stronger business models with our store owner folks back then. So I'll get to a little bit more about the end of that story, or sort of the implications of that story in a moment. So really, as Hannah mentioned, I want to provide a very quick overview of the regulatory world of retail alcohol and offer some of my own suggestions around collaboration here. So in alcohol policy, we really look at the 4 Ps, which is an alcohol industry construct, and when they work promotion and place and product and price together, they call that total marketing, and that is really a very powerful lever to influence behavior. And what we're going to focus on today is the place part of that, and place is really connected to availability. So we know both in alcohol and tobacco, and we're learning now in sugary drinks as well, is that if you can shift availability, especially through place, you can shift consumption, meaning if you have more alcohol outlets in a community, in a state, you will see more alcohol consumption and more alcohol-related problems. We saw that same sort of equation work in tobacco, and we're getting research that tells us that same equation works with sugary drinks. So place is a very powerful policy lever, and in the alcohol regulatory world, what we saw was after Prohibition ended in 1933 that a number of states went in one direction, which was to become a licensed state, like California. A number of states, almost I think back when Prohibition ended, close to 20 states had what's called a monopoly state, where the state controlled some or all of the retail operations there. The monopoly states are melting away. There's, I think, less than 10 now. More states are what's called this licensed state, where basically retailers are licensed by the state. And really, the construct back then when Prohibition ended was that states were supposed to look at health and safety concerns. And my observation is that states have really thought more about the safety side than the health side. They do have this health mandate, but there is very little public health thinking in most states' alcoholic beverage control approaches here. Because of that sort of limited approach to regulation, local land use became a much more powerful strategy in California, and is also a bit of a trend in other states. So we've heard a little bit already about local zoning on this call, so I just stayed a very high level here. But locals have little input on state liquor licensing. They get heard, but they don't really have a veto vote per se. But there is a provision in the state licensing laws that says before you get a retail alcohol license, you need to go through the zoning car wash and have all your zoning permits in place before you get your state license. And that little quote-unquote loopholes really open up the door in California, at least, and other places, to really have cities and counties flex their local zoning powers. And there's different versions of that we don't have time to get into. But it's really been, again, sort of a vacuum that has been filled in part by locals because the state regulatory structure really isn't covering the waterfront as much. So getting more to the meatier part of this then, in terms of thinking about collaborations between nutrition and alcohol control, there are some clear shared goals, I think, that I've seen having worked in both fields here, both issue areas. And one is how we can use youth and youth empowerment strategies, youth engagement strategies have long been a programmatic focus for many nonprofits as well as for government. There's been some interesting work that's been done with youth, both in alcohol and tobacco and now in nutrition, and I think the youth to support outreach to store owners to sort of open that door and provide that community voice is a potential shared goal. The buy-in by local store owners is really also a shared goal, and again, we've already heard that we come at it from different angles. I think tobacco and alcohol do have a more stick approach where nutrition might have more carrots, but at the end of the day, it is all about sort of community improvement and how corner stores can be seen as more value added for public health and safety rather than a negative. And developing stronger business models is really where we've been trying to get to for quite a while from whatever perspective we've been using. And I think really the challenge here that I've seen over time is that it's easy to get that nanny state tag, saying, well, who are you to socially engineer my store? What gives you the right? What gives you standing to come in and tell me how I should operate my business? And I think clearly we need to build relationships not just with business owners, but one of the real lessons learned, I think, from alcohol is needing to work with business associations. And there are all kinds of associations, whether it's the retail alcohol side or business districts. But going store by store is a bit labor intensive. It's great to get some early adapters and get some early buy-in from individual store owners, but I would really think harder or as much about working with business trade associations. And that just has more of a systemic potential for change rather than going business by business. So we've heard a couple of these approaches already. And there are sticks and carrots to think about when we think about how to work with corner stores. The signage we already just heard about from tobacco side. Clearly thinking about voluntary approaches to decrease negative signage or just enforcing the laws that are in place. Not to mention, this is more from the nutrition side, pointing out and creating some spaces in the store where there is healthy food, quote unquote. So signage is an interesting sort of gateway effort, I think, that can open up the dialogue because it's not necessarily going to work all the time to start with a stick approach. It really depends on what sort of community organizing you're doing and how much the business owner world is engaged with your work, especially if you're developing coalitions. Are you trying to bring in business owners or chambers? And you don't want to jump in on big sticks if you're trying to engage business leadership, say, in your coalitions. So that's a very sort of individual decision to make. Sticks can be certainly effective too, though, depending on, again, where you're at with your work with local store owners and local business leadership. But we do know that some of the commonalities here about, for example, pricing is pretty critical because, you know, the alcohol beverage industry, for example, sees alcohol as part of the beverage market. And now we're learning a lot more about the sugary drink world and how they capture so much of the beverage market. But they're all looking at one giant beverage market, and I think our challenge is to think about a healthier beverage approach. And for example, we've done a lot of work around sugary drinks in King County and the Seattle area, and we're really rethinking our framing around that because just going negative on sugary drinks I think only gets you so far. We're talking more about healthy beverages. And when you do that, I think you can bring in both alcohol and nutrition under that tent. Clearly, compliance and having more effective collaborative work around compliance because there are limited resources, but if those powers that be hear from a number of groups that we need to have a stronger focus on compliance around whether it's drinking age or smoking age, etc., that's where we can hold some hands together and advocate to our local law enforcement, code compliance, etc., to prioritize this work. Because enforcement isn't a neutral world. Advocacy is an important part of prioritizing enforcement choices for those that do that. Here's an innovative idea that's on the slide here, this third bullet about a child health and safety zone, and it overtly brings all of us together. I have not heard about any place that has done a version of this, but essentially there's a lot of land use that includes distance requirements, say from schools or child care centers, and we're kind of doing this in a shotgun approach here. Alcohol has to be so many feet from schools and child care centers and tobacco, and now in some of our states, including Washington, we have retail marijuana on the horizon, and in some more states we have medical marijuana dispensaries in the mix. So we're playing with this idea with the Statewide Childhood Obesity Prevention Coalition that I'm part of here in Washington State as a policy platform idea for the upcoming year. So again, innovative. If people know that this has been in play anywhere, I'd be very curious to hear this, but this is a great idea and a way that we can knit together a lot of our work. And again, this would be more prospective, like new land uses proposed. It's really hard to reach back in time and tell existing stores you can only be so far from places. So this has got that sort of limitation to it. So just to finish up here, I think clearly there are opportunities. We do not want to trip over each other as we're coming from different aspects of public health. Alcohol and tobacco sometimes are part of public health agencies. Sometimes they're separate. They're kind of cut up with mental health, behavioral health. We need to figure out how to better hold hands. And we've already heard the challenges around that. We have different funders and time frames and regulatory frameworks. But really, at the end of the day, when we're all going out talking to business owners in separate ways, that's really only going to frustrate them as the target of our work. And if we figured out how to have that dialogue in a more cross-collaborative way, I think that's just going to, at the end of the day, create more success for all of our interests. So I'm really supportive of having this kind of a webinar to stimulate more thinking to get more cross-sector collaboration underway. So I know we're at about time, and I certainly will be sticking around for the office hours part and hope to hear your questions at that time. Thank you.
Vic, thank you so much. There have been several questions that have come in over the wires for you, but we're going to hold those for the office hours portion in the interest of time. So I wanted to just try to pull together what we've heard from Vic and Malia, who both gave, I think, just a lot of food for thought for healthy eating advocates. As you listened on this call, you got this overview into the world view of how alcohol and tobacco control views the retail environment. And I think a lot of differences are pretty obvious right away. But I'd like to return to their recommendations for partnerships and try to summarize them. I heard several really great ideas that I would group into two big buckets. And the first is a set of voluntary approaches for working with retailers. And I really heard Vic and Malia invite their nutrition advocates into their work, which is more regulatory in nature, but understanding that that nutrition advocates actually have quite a lot to offer to strengthen that approach. Both Vic and Malia described how in certification we can provide incentives to retailers to shift to a healthy business model, can really be a natural way to integrate standards that address tobacco, alcohol, and nutrition. And they also both touched on how voluntary approaches to improving signage by asking retailers to limit the marketing of unhealthy products and bring in more marketing of the healthy choices have great potential, and that's something that I'd really like to explore more in the virtual office hours. I was also really interested that you both raised this idea that it's not just what we're trying to do, but who we're doing it with. I'm really intrigued by the idea of the role of youth in this work, and as well the idea of bringing more community members to strengthen our approaches. And I'd like to remind folks to please join us again on July 30th for our webinar, where we'll really dig into that question of how do we engage community residents. And I think that this webinar has offered some open windows there. To those of you who work to improve nutrition environments with the support of the USDA or with other funders that place some significant restrictions around policy approaches, I think that second bucket of strategies that are partnerships towards policy, we know that there are restrictions there, but I also heard quite a few opportunities. I was quite struck by all the different ways in which both Vic and Malia emphasized how valuable the voluntary approaches of nutrition advocates are to supporting future policy adoptions around healthy stores. Specifically, I think the kinds of technical assistance and incentives that healthy eating advocates often offer store owners help prepare the businesses to comply with policy approaches down the line. And can provide some of those early wins and business supporters. I'm always really interested in those store owners who figure out that they can be really successful differentiating themselves from the pack and doing something different with those healthy options. And I think some of those business champions that you may already be working with could be really important allies for future efforts by tobacco and alcohol control advocates to go for citywide policies and help diffuse some of the arguments that it's not possible to have a sustainable business model that doesn't rely on alcohol and tobacco. That's why I think, in sum, I think it's so important to have those initial conversations with your colleagues in alcohol and tobacco control so that you can coordinate approaches even if your funding source may not allow you to work directly on policy. So thanks again to Vic and Malia for offering so many ideas, and I look forward to continuing in conversation with you during the virtual office hours. I hope folks on the line will stick around for that. I wanted to just summarize the resources in one place that were mentioned on the webinar today. For healthy food retail resources, Malia emphasized the Health on the Shelf, the overview of certification programs. I wanted to highlight Green for Greens always. That's a fantastic resource for public funding for supporting healthy food retail work. I think collaboration doesn't come for free, so we may need additional resources to support that, and Green for Greens is a great place to find that. Malia mentioned the two licensing approaches, the tobacco retail licensing and the healthy food retailer licensing approaches. And I would say that even for those of you who don't intend to work on policy approaches at this time, the standards in the healthy food retail licensing ordinance are a really good goal to shoot for that may lay the groundwork for one day passing such a policy in your community. I think it's a great way that you can begin as you mean to continue. Vic mentioned the idea of a healthy zone around schools. My organization created a model healthy food zone ordinance that at this time only includes fast food and mobile vending, but we're very interested in looking at a broader approach. We're currently looking at a model policy to restrict sugary drink sales near school, really building on the idea of safe routes to school, incorporating not only physical activity, but the sale of unhealthy products in places that children frequent. For those of you who are not familiar with the Healthy Corner Stores Network, you can sign up for the listserv and join webinars and get networking and technical assistance referrals at healthycornerstores.org. And then finally, of course, our disclaimer, although I'm not a lawyer, you were joined by lawyers on the call, and any words that they spoke were not intended to constitute legal advice. But we do hope you will contact us for a non-legal advice following this webinar. We'd love to continue the conversation with you, and we'll dive into the office hours portion. Vic and Malia, I have a series of questions that I want to ask you, and I'd like to ask those of you on the call to type in your answers and thoughts on these questions into the chat box, again in the lower left-hand corner of your screen. We're also going to be taking some of the questions that you asked during the webinar that we weren't able to respond to. So to kick things off, I wanted to return to the equation that I offered at the beginning of the webinar, which said that standards plus incentives plus enforcement equals bananas. And for Malia and Vic, I'd like to begin with the role of enforcement in Healthy Corner Store work, since I think that's one of the biggest areas of difference between the strategies that healthy eating and tobacco and alcohol control advocates take. Vic, could you start? I'd be interested to hear from your perspective, what is the role of enforcement in maintaining the standards of alcohol control regulations at the retail level? And before you respond, I'd like to ask those of you who are working as healthy eating advocates to think for a moment about your answer to the question, does enforcement have a role to play in maintaining healthy food retail standards, and why or why not? Let us know your perspective as we listen to Vic.
Okay. Guess it's two parts. One is the state level. So that's the alcoholic beverage control for California and analog agencies in other states. And so they are law enforcement officers. I haven't seen the recent ratio numbers, but it's always been a little scary at the limited number of agents. Where I last left off, there were like, I don't know, 250 agents or so for like 75,000 retail licenses. So they have to really focus their energy on multiple offender type situations. There's not a lot of sort of community policing, sort of let's just walk in and scope things out. You know, there's no deterrent sort of aspect because they don't have the numbers. And I would be surprised if that was a different scenario in many other states. It's just hard to get the funds together to maintain the right kind of ratios. At the local level, it's if there are zoning laws in effect that impact retail alcohol, then your code compliance officers at the county level would be the eyes and ears there, but of course they are strapped as well, and looking at compliance with, you know, typical zoning concerns around lighting and loitering and littering and those things may not also be on the front burner for those enforcement folks as well. So they have enforcement in place, but you know, the effectiveness given the ratio of numbers available is in question.
Thank you. Malia, what's your perspective on the role of enforcement in maintaining tobacco control healthy store standards? While we wait for Malia to rejoin us, I wanted to give an answer to a question that came in the chat box. Someone asked how to find out if stores have violated any of the food-related regulations with regards to SNAP, WIC, or the Food Retail Code. Questions about the Food Retail Code could be answered by your county health department. Most often, this would be within environmental health. SNAP would be handled through the Sacramento office for the FNS SNAP administrators, and WIC would be through the California Department of Public Health. And we can include phone numbers for the latter two in the follow-up email that everyone will get. At the conclusion of this webinar, we'll send a link to the recording as well as links to the resources that were mentioned on the call today. Malia, have you been able to rejoin us?
Yes, I cleverly had my mute button deployed, and we're now out of mute land. So I'll talk about tobacco enforcement briefly. I think we found throughout the state that tobacco enforcement is most effective when a community has that local tobacco retail licensing law, because they just have a greater degree of control over when compliance checks occur. And by that I mean decoy operations where youth go in and actually try to buy tobacco. But it also gives communities the opportunity to inspect for whether the retailer is complying with signage laws, for example, whether they're complying with laws that prohibit self-service displays of tobacco or prohibiting sales of individual cigarettes. And so from the tobacco control perspective, certainly the state has been, of course, involved in enforcement, but in terms of consistent efforts to make sure that minors do not have access to tobacco, I think most advocates would say that having some local control over enforcement through a local tobacco retail licensing law has definitely helped to reduce the sales of minors throughout the state.
That's great. Yeah, it's really interesting to see how the regulatory approach seems to be coupled with an enforcement approach, but that's I was interested in your perspective, Vic, that there's sort of an inadequate number of enforcers, and that we're seeing in alcohol and in tobacco control, local communities feeling that the state laws are not adequate, so seeking additional regulation to shore up that enforcement of those strategies. So really, I think again, emphasizes the point that providing also an alternative so that there isn't that continuing economic incentive to illegally sell alcohol and tobacco is so critically important. And in fact, I'd like to turn to the role of incentives in your work now, since we've had quite a few questions about that from our audience. From your perspective, Emilia, maybe you could speak first. I know you answered the question specific to tobacco retail licensing, but what role do you see for incentives in limiting the impact of tobacco availability in your community? I mean, can you, wearing your regulatory hat, see a role for incentive? And if so, what might that look like?
Sure. I think, as I mentioned earlier, it would be great to collaborate more with nutrition and figure out how we can more effectively deploy incentives in tobacco control. I'll mention that our Health on the Shelf product that Hannah mentioned earlier on certification programs lists a great deal of ideas for incentives, and I think several of those incentives would actually be really interesting to use in the tobacco control context. So, for example, some of the incentives we talk about are you might consider reducing a license fee for a retailer who goes above and beyond the basic requirements. So we could think about maybe we'll reduce the licensing fee for a retailer that agrees to remove some of its tobacco advertising or reduce the amount of tobacco that it carries. And while we're talking about advertising, I think another incentive that would be great to offer potentially in the tobacco context is whether we can offer some incentives regarding improvements of store facades. Maybe, especially, you saw on the slide I had earlier, there was significant graffiti on the store that I showed. So how can local governments help with graffiti removal in exchange for an agreement to reduce the amount of signage that you have? Or are there other improvements to the store that could be made, such as a new awning, or helping with, as Vic mentioned, maybe some external signage that actually promotes the healthy products that are in the store? So those are some areas that I can think of off the top of my head that might be great to incorporate into either voluntary efforts or into a tobacco retail licensing program.
Yeah, that's really interesting. One of the main funding mechanisms for facade improvement has as its end goal nothing to do with nutrition, tobacco, and alcohol or alcohol control. It's the Community Development Block Grant Program, which is administered through HUD, which has as its goal broadly poverty alleviation and community revitalization. And so I think it would be really interesting to look at the role of community development block grants, which are available in distressed urban and rural communities throughout California and in most states, how to tie standards for what happens inside the store as a condition to getting these grant funds to improve the exterior of the store. Certainly that would be a more holistic perspective on community revitalization, that it isn't just about an exterior makeover, but really of the full transition, which is very much a concept in planning. There's this idea of the quart of milk test, whether a store is a place where you can send your 8 or 9-year-old to pick up a quart of milk and a loaf of bread. And that sort of thinking has brought this federal funding to improve exterior, but it's not ever linked into the interior. So the silos obviously continue way beyond just the three that we're talking about today. Vic, I have a couple of questions for you, but just to start. From your perspective, do incentives have any role to play in limiting the impact of alcohol availability in a community?
They have to some limited effect. I love the concept. What got tried heavily for a while, mostly at a local level, were to run both servers and managers through training programs, so responsible hospitality programs, responsible server training. They came under a couple different names, and underneath that, community coalitions were built, and sort of good housekeeping seals were attempted, and that really was just super challenging to get off the ground. But I wouldn't throw the baby out with the bathwater on that idea. I think it's a good concept, but it requires real thinking, strategizing, resources. If you're really going to build a good housekeeping seal and say, oh, this is a special corner store, you've got to have the resources to market it and make that good housekeeping seal truly value added, so it's seen by the community and the effects of that are seen by the business owner. So I just think the care and feeding of that requires some real energy.
Right, and probably a coupling with enforcement, both really valuable and really enforced in order for it to work.
That's right.
A few follow-up questions for you. We're getting some questions from the audience about the incentives that tobacco and alcohol companies offer to retailers. From my research into this area, it's equally there are also incentives coming particularly from sugary drinks manufacturers as well as some of the snack foods. These can take the form of price incentives, of requirements about where products are placed, about how they're promoted within the store, to requirements to hang up advertising. There are a broad array of forms that these incentives take. I'm curious to hear from either of the two of you if you have any recommendations on getting the retailers to give up those incentives, or any strategies to counteract them, or are they just a reality that we have to work around?
I can jump in real quick. We have limited resources in our field, and I know there were some grant efforts on the healthy eating side that did pay for refrigerated units, et cetera. I mean, to the extent we can provide some capital dollars like that, that's great, but it's just not a level playing field out there. So I think we need to speak both with whatever limited resources we have and try to pay for capital resources like that. But I think it's also, if not more, the community power, the people power, the voice that goes to the business owner to say, hey, a different kind of business plan would truly be a win-win for you, right? It would sustain your business potentially, and you become a more valued community member. But I think that's where incentives comes in. It's like, what does that really mean? How do we put some meat on that bone to make community-based incentives feel real? So it's not easy work, but it's the right work to do.
Thanks. Malia, any experience on from your perspective on addressing the incentives that tobacco companies provide to retailers?
I wish I had some great answers to responding to those incentives, which are so powerful. But I think as a baseline, as we're doing this work, it's really important to speak with retailers and get a sense of what are the incentives that they're being offered, what type of advertising are they being asked to display. Is there anything that we can do to sort of not replace those incentives, but as Vic mentioned, offer an alternative business model? But I think having the conversation with retailers before, for example, trying to address signage goes a long way into reducing community opposition. So just getting a sense of what are the incentives, what are our retailers dealing with, how much do they impact their business model. Again, that's really critical groundwork before doing more around the signage and advertising issues.
Thanks for mentioning signage, Malia. I wanted to follow up on that since you and Vic covered that both. What are my understanding of the lessons learned from tobacco control's efforts to implement voluntary signage programs was that they were not very sustainable, that advocates would go into the store and get the store owner to agree to remove the signage, but ultimately it would go back up, perhaps because the tobacco rep came back to the store or the store owner had a change of heart, but in any case they didn't sustain that over time. And yet both the two of you flagged voluntary signage approaches as a promising point of collaboration. How would you map sort of a voluntary approach? What comes after that would be more sustainable? Is it adopting a citywide signage ordinance that lowers the percent of storefront that can be covered, or do you have something else in mind about what comes after these voluntary signage efforts?
Yeah, again, challenging to do because I think we all can see with our naked eyes what a store looks like that is just covered in signage and doesn't look aesthetic, and it just gives an impression of this is not a store that is value added in the community. I think signage has got that sort of symbolic power of giving a message to the community of we care, we don't care. So the voluntary, I think, is really tactical just to engage store owners, and the compliance there is going to be all over the place. But I think that does lead into, however that goes, to the deeper policy work around signage, because sustaining voluntary efforts is super challenging. So I see the voluntary work as really an entry point in dialogue with business owners rather than the end point.
Malia, did you want to add anything there?
I think that's a good summation of the issue. Again, if you don't have the capacity to continue to maintain a voluntary campaign, in some communities I know they've done great youth work around signage, and youth have definitely I don't want to say shame, but youth have definitely exerted pressure, let's say, on corner stores, for example, to comply with our state law regarding alcohol retailers and signage. And So to the extent that you do have resources for youth engagement that can help, I think, maintain and keep in place voluntary agreements. But beyond that, I don't have much to say except whether it does make sense to examine a policy and a local zoning requirement, for example, that would restrict the total amount of signage.
Yeah, thank you. I was reflecting from my own experience working in corner stores, very much having the experience of not with signage, but with product placement, trying to shift where products were placed in the store with the consent of the store owner, and coming back the next week to find that the unhealthy products were back in their prominent location. And I think that points really to the importance of working with the store owner to understand the distributors and the companies that they're working with. Some of you may have been able to join us on the distribution webinar earlier in June. ChangeLab Solutions will also be releasing a guide to a fact sheet on some of the work that New York City has done around working with the distributors to make sure that the healthy foods are readily identified at the distributor level to make it easier for store owners to choose those healthy options, to make sure that the distributors carry healthy options, and to make sure that when possible they provide advertising for those healthy options as well. So it's not a clean slice of, it's not as clean as just taking down the advertisements, but it's working a little bit more deeper and more upstream with the distributors to make sure that they do carry healthy options. Of course, there's not a healthier cigarette or healthier alcohol, so that's not necessarily a transferable strategy. But I do think working with distributors is an important strategy for healthy eating advocates. And for those of you who didn't have a chance to join that webinar, do check it out on our archive. I also wanted to say on the incentives piece for nutrition advocates and tobacco and alcohol control advocates alike, I think the list of incentives in the Health on the Shelf guide is really excellent, so that's one place that I would refer you to. And also to our webinar archive. We did a similar series supported by the California Department of Public Health last summer, one of which touched on incentives. So that's a place where you can watch a webinar if that is a preferred mode of receiving information. That or Health on the Shelf can provide a great overview of incentives specifically for nutrition work, but many of them really transferable to alcohol and tobacco control as well. So we're coming up close to the 12:30 hour, and I wanted to thank all of you for joining us today, and I really have appreciated the dialogue with Vic and Malia, and feel like there's really so much more that could be explored in terms of this idea of collaboration. I hope that those of you on the call will pick up the phone or send an email to your counterparts, whether they be in nutrition or alcohol control or tobacco control, and really get to know each other to understand where you're heading and what the opportunities are for aligning those efforts, because it's pretty clear that it's really going to take all of us and probably many other partners to do this work, but understanding each other's end goals, I think, is a very important prerequisite for building those near-term strategies for getting there. So thank you again, Malia Schultzman and Vic Coleman, for joining us. This is Hannah Burton-Lorison. You can access technical assistance and advice on Healthy Corner Store related strategies from ChangeLab Solutions by emailing us, info@changelabsolutions.org. And we appreciate your attendance in this webinar today. Thank you so much.